please welcome 7-time Emmy Award and Edward R. Murrow Award recipient, journalist and news anchor, Thuy Vu.
Hello, everyone, and welcome to the second annual UCSF Digital Health Awards. My name is Thuy Vu, and I will be your host tonight to honor many of the best advances in healthcare, especially in digital health, by far the fastest growing sector in healthcare in terms of investment and interest. We'll also pay tribute to our COVID-19 heroes, those innovative companies working tirelessly to help ease this pandemic. As many of you recall, our inaugural UCSF Digital Health Awards were presented live at the UCSF Mission Bay campus in front of 500 people. We had planned to be at the Mission Bay Conference Center this year with over 1,000 attendees, but due to the pandemic, we're having more than 120 participants that would include moderators, presenters, and companies join us remotely from around the country. And we're producing this event with a small, socially distanced crew here on our virtual set at Beyond Pic Studios in downtown San Francisco. Just a little background here now on how this all started. 2 years ago, Mark Goldstein, an investor in healthcare technologies at Builders Venture Capital and the founder and chairman of UCSF HealthHub, was meeting with the UCSF HealthHub board, and he spun an idea about creating an event to elevate the emerging field of digital healthcare. The event you're seeing here tonight is in recognition of the importance of how healthcare is evolving and how the pandemic has accelerated that evolution. So without further ado, I now give you Mark Goldstein.
Thanks, Thuy. Well, let's face it, 2020 has been a really nasty year here in Northern California and worldwide. It's really sucked. We were all grumbling, we were all unhappy, and we feel this inside of us. And we considered postponing our event. Last year was a big celebration. But we said, wait, this is a time to celebrate. This is a time to congratulate the companies that are the unsung heroes of the COVID-19 pandemic, the innovators of digital health. Great tech companies doing their best to keep us safe and healthy in a time that's so hard to do so. Sit back. We've assembled an amazing group you're going to hear from for the next 90 minutes. Next slide. HealthHub is a nonprofit. We're the producers of this event. And our mission is to help health companies scale and grow. Early on, that means helping them find the right advisors, investors, PIs, or marketing people. And later on, it's helping them with validation and getting them faster to market. We host events at our Mission Bay campus when we can. And we host monthly webinars, seminars, and events all over, including at the JP Morgan show. We're now 10,000 people strong. We're based here at UCSF, and at UCSF, we believe we're at the undisputed center for healthcare innovation worldwide. Next slide. None of this could have happened without our sponsors. These organizations are taking a gamble with their marketing dollars to support a 2-year-old organization. We are really thankful. Wilson Sonsini, NTT, Novartis, Silicon Valley Bank, JP Morgan, and Livongo. A number of these organizations are sponsoring awards, and Wilson Sonsini is offering an incredible amount of complimentary legal services to all of our quarterfinalists. Next slide. HealthHub is supported and funded by the venture capital community, firms like mine, including Mayfield, NEA, DCM, Great Point, and Bloomberg Capital. All of our costs are supported by their donations and their efforts, and we couldn't do this without the venture community. Next slide. And then we have all of our health collaborators, accelerators, incubators, and studios, firms like MedTech Innovator, Dream It, Plug and Play, and Startup Health. 70% of our 1,000 submissions came from these programs. They were spawned there. And at HealthHub, we're really proud to bring this entire community together for this awards event. Finally, at UCSF. UCSF, we're just the innovation, we're the external face of all the amazing work, the innovation that goes on at UCSF. There are literally a dozen internal innovation groups, and I get to introduce you to Barry Selleck, who runs Innovation Ventures, the entity that ties them all together. It's my personal partnership with Barry over the last 3 years, which has brought all of us here. He's a fellow Penn grad, he's an ex-CEO himself, and he knows quite a bit about running a company and spawning innovation. And with that, I'm going to turn this over to Barry.
Thank you very much, Mark, and welcome everybody. I'm the Vice Chancellor of Business Development, Innovation, and Partnerships at UCSF, and have been Mark's internal partner for HealthHub since its inception. I'm also responsible for the Innovation Ventures program, which you'll hear more about later this evening. As a leading academic medical center, UCSF has a global mission of improving health worldwide. To that end, many of the presenters tonight are faculty who have been at the forefront of the digital health revolution from its outset. Now, with that being said, to the extent that working with the finalists here tonight can further our mission, we would welcome the opportunity to do so. Next slide, please. Before we get into the actual presentations, I want to briefly summarize how the companies represented here tonight were selected. Starting 3 months ago, we've received over 750 submissions in 15 different categories, and through 4 rounds of judging with over 250 judges, have ended up with the finalists that are represented here tonight. Next slide, please. The first round of judging, the companies were evaluated on 8 different criteria listed here. They were scored on a scale of 1 to 10, with the exception of the customer validation and market traction categories, which were given additional weight simply because we want to ensure that these technologies are actually being used and benefiting patients and care providers. After evaluating the companies on all of these different criteria, the highest scores then advanced to the next round. Next slide, please. And were then evaluated based upon these 5 criteria: value to customers, level of innovation, level of validation, market traction, and level of differentiation. Next slide. The 60 finalists that resulted from that selection were then evaluated based upon impact, innovation, reimbursement, evidence, and differentiation. And it's the finalists from that category, the actual winners from which are selected and which will be disclosed this evening. So with that being said, again, I'd like to thank you for joining us this evening and hope that you're looking forward to the presentations as much as I know that I am. Thank you.
Thanks so much, Barry, and my thanks to Mark Goldstein as well. As you just heard, this is a very, very vigorous competition. So it's my pleasure and honor now to kick off the first category. And that category tonight is for the best electronic health record advance, a product or service using data in electronic health records for improving patient outcomes. Presenting this category will be UCSF Associate Vice Chancellor for Informatics and the Chief Digital Transformation Officer, Dr. Michael Blum. And together with Michael, we have Urshit Parikh, partner with Mayfield Ventures.
Good evening, and thanks for joining us. I'd like to thank Mark and the UCSF HealthHub staff, our UCSF community, the many judges who volunteered their time, and especially our wonderful digital health companies, whom we respect and admire so greatly. Before I went to medical school, I was trained as an engineer, and I've spent my career working to bring the benefits of technology to our patients and provider communities. Over the last 30 years, I've had the privilege and bear the scars of being an early EHR adopter and of driving large EHR implementations. Sadly, these days that can sound more like a confession than a worthy career. EHRs have undeniably had a tremendous impact on care delivery, patient and provider experience, and much of that has been very positive from the perspective of patient safety, communications, clinical data access, and compliance. However, much remains to be done, as the EHRs are significant contributors to provider burnout, our patient records remain disconnected across a patient's care experience, and the promise of clinical decision support remains unfulfilled. Some of our EHR vendors have been slow to meaningfully adopt technologies that would allow data to flow more freely, leaving the data locked in the EHR and new technologies starved for access to data and clinical workflows. While EHRs are and will remain a major part of an organization's IT infrastructure, they are only a piece of the ecosystem required to provide patients and their families with excellent 21st century care, a contemporary mobile user experience with appropriate self-service, and the increased efficiency that provider organizations desperately need. As we continue to redefine possible at UCSF and across the nation, we need new leading edge tools connected to EHRs by standard open APIs that power thoughtful applications of artificial intelligence, data and device interoperability, remote monitoring, and cost containment. Each of these finalists exemplify parts of the EHR ecosystem that we need in order to improve care and better support our patients, families, providers, and healthcare organizations. And now, a few words from my colleague, Urshit Parikh, as he will present the semifinalists and announce the winner.
Thank you, Michael. Good evening, or good morning, good afternoon, based on where you are in the world. It's with great pleasure that I have been able to see Mark and Barry really realize the vision of UCSF HealthHub, and has been a delight to have been supporting that from the beginning. As we look at the past year, health systems across the country have been at the forefront of COVID response. Just as a proof point on what an innovation forum like this does, the winner of our EHR award category last year was Cuventus. And Cuventus has been at the forefront of enabling health systems create COVID command centers and really change, adapt their operations for supporting COVID operations. This has happened with some of the most critical sort of places like New York, with New York Presbyterian, but also for major government agencies to ensure that the right ventilators and resources were available to the right people at the right time. I feel confident that we're going to go ahead and get out of this, and our health systems are actually going to come out shining as the shining beacon. And for that to happen, we are also going to see COVID really unleash the e-commerce moment in healthcare, and for the health systems to then really deliver this next generation consumer experience is where our sort of nominees all fit into. So, the finalists for this category this year are RX Review, Ambra Health, Human API, and LeanTus. And the winner of our EHR Advanced category is Human API. And I believe Andre Pop, the founding CEO, is going to be accepting the award. Congratulations.
Awesome. Thank you so much,
Human
everyone.
API gives
and
businesses
thanks to
a
UCSF for hosting us and for putting on this award. And I just want to say that Human API is building the modern transaction layer for health data. And in our view, the right way forward is to put the consumer in control of their data and to use that power to create data liquidity across the entire ecosystem. And that is the only way that we can radically accelerate innovation across the whole space. So thanks to our customers, thanks to the team who made this happen, and thank you to UCSF. We're really honored.
Human API gives businesses a simple way to allow consumers to share their health data to power innovation. We're on a mission to help people everywhere live longer, healthier lives. Human API, maximizing human potential.
Awesome. Congratulations to Human API. All right, our next category is especially prominent across many technology sectors, the best new digital health solution or service that is improving patient outcomes using new applications of AI. And presenting for this category are last year's Hall of Fame runner-up, Glenn Tolman, Executive Chairman of Livongo, and AV8 Ventures partner, Ruchita Sinha.
People living with chronic conditions. Busy moms like Julie need to make every minute count. But managing diabetes can feel like additional work. But it can also feel easy with tools like a connected meter with unlimited strips that provides real-time feedback, empowering Julie to better manage her health. Livongo provides timely and actionable tips to help her practice healthy habits, such as easy food swaps that minimize blood sugar spikes after breakfast, Julie has easy access to tools to help her take care of herself in her own time, including in-the-moment health nudges, such as a breathing exercise to help manage her stress levels. No matter the time or place, an out-of-range reading triggers live support from an experienced coach who she can trust to guide her through a challenging moment, while uncovering underlying barriers and motivating her with long-term strategies for success. Julie gets confidence from expert support and the comfort of knowing her loved ones are in the loop. By turning real-time data into powerful yet personalized health signals, Livongo meets members like Julie where they are to empower them every step of the way on their journey to better health.
Well, thank you very much. And let me begin by thanking UCSF Health for putting on such an important event. I have to say, I love the opportunity to recognize great companies using technology to improve how we deliver health and how we deliver care. And I love to connect with people who are passionate about creating a different and better experience for health consumers. So today I'm excited, really excited, to introduce the Best New Application of AI Award. And you might imagine that this category is just a little bit important to me, and I would suggest to the industry as well. Whenever we talk about technology, it's important to note that it's never really about the technology. It's really about how we apply the technology to create a better experience that leads to measurable outcomes. You know, people don't care about the chip in their phone or what data science we use. They just want the phone to work, and they just want it to meet their needs. Well, last year, I'm pleased to report that Livongo won the Best New Application of AI Award, this award for our data science team's amazing work using data to create a different and better and more personalized experience for Livongo members. And Livongo members, as you just heard, are people living with chronic conditions like diabetes and hypertension and really important things. At Livongo, we call this AI plus AI, which stands for aggregate, apply, interpret, apply, and iterate. Well, we use our cellular connected devices to aggregate substantial amounts of information. We get this from our connected devices. We get this from all different sources. And then we interpret that information to understand what it means for each individual member and to personalize it. And then the magic starts. We apply it back in a way that's most useful for all of the people, whether it's through the device, whether it's through a phone call, a digital nudge, or even their Amazon Alexa device. And last but not least, we iterate to see if it worked. It's kind of like rinse and repeat and keep doing it until we know what our members like. You know, Arthur C. Clarke had a quote that I really love, and he said, "Any sufficiently advanced technology is indistinguishable from magic." Well, we can use technology, like you'll hear about tonight, and data science to create magical experiences. And we can really make it easier for people to stay healthy. That's why this excites me. So I'll close by saying that in the time of the COVID-19 pandemic, it's shown us that nothing's more important than our health and well-being. And we all have an opportunity, and frankly, I'd say it's an obligation to use technology in ways that makes it more effective, more personalized, and actually creates better outcomes. And so now what I'd like to do is turn it over to Rashika, and she'll announce the winner of the Best New Application of AI Award. So Rashika, it's all yours.
Thanks, Glenn. Hi, everyone. My name is Ruchita Sinha, and I am a partner with Aviate Ventures, which is a venture fund focused on early stage technology and healthcare companies. At Aviate, AI is pretty much core to everything we do. And we believe that AI will be as transformative to the healthcare industry as mobile technology was for social media, or as sequencing was for the diagnostic and therapeutic industry. In fact, probably in a few years' time, we won't need a category like this because AI will be so core to everything we build within healthcare. But until then, the finalists of the new application of AI award category today are Carius, Gauss Surgical, Viz AI, and Suki. Today we have with us Sivan Berkovici, the CTO of Carius, Siddharth Satish, the CEO of Gauss Surgical, Dr. Chris Mancy, CEO and co-founder of Viz AI, and Genevieve Lee Simon, the Senior Director of Marketing at Suki. Congratulations to all of you. You all are winners. And the winner of the category for 2020 new application of AI award category is, and I'm going to rip open the virtual envelope. Congratulations, Chris from Viz AI.
I should probably sign off because our helicopter crew is here now with the first of the 3 Viz alerts I got while I've been talking to you guys. So time to get to work.
You have won Viz AI. We want to hear some great remarks from you. Congratulations.
Yes. Hey, my name is Chris Mancy. I'm a neurosurgeon, CEO of co-founder of Viz AI. Thank you very much. We're elated to win the 2020 US Digital Health Awards in the new application of AI category. And we're extremely honored to be considered along with such esteemed companies in this category. All of the companies nominated here today are doing fantastic work to accelerate AI in healthcare. Our mission at Viz is to fundamentally improve how healthcare is delivered in the world through intelligent software that promises to reduce time to treatment, improve access to care, and increase the speed of diffusion of medical innovation. In stroke, time is brain. Patients lose 1.9 million brain cells every minute of delay of treatment. And I'm very proud that we've developed a system of action that is shaving hours off those time delays, resulting in significantly better outcomes for patients and greatly improved quality of life post-stroke. At Viz AI, we're leveraging AI to detect suspected strokes and other medical conditions on medical imaging. Our platform sends immediate alerts to the entire care team on the convenience of their mobile devices. It's a real testament to the team and all the hard work that they put into this company. AI is quickly entering the healthcare space, and we are proud to be the first company to receive an FDA clearance for AI back in 2018. And yet again, a few weeks ago, the first company to receive a new technology add-on payment from CMS for AI software. And now even more proud to be the winner of the UCSF Digital Health Awards for AI. This is a really exciting journey for all of us in this space. We're here to do this journey with you, with all the doctors, nurses, and healthcare providers, delivering cutting-edge technology so that we can get the right patient to the right clinician at the right time. Thank you very much.
Hi everyone, my name is David Rue, and I'm the Global Chief Medical Officer for Microsoft. By way of background, I'm an infectious disease physician who trained during the AIDS epidemic. I saw firsthand how a virus could kill indiscriminately and how important it was for public health and science to lead. Today, we're faced with another deadly virus, and again, we need public health and science to lead. We also need to accelerate the pace of innovation, and that is where technology can play a critical role. With digital health technologies, cloud computing, artificial intelligence, machine learning, we have the opportunity to accelerate the pace of innovation and hopefully enable faster resolution to the pandemic. Thank you for all that you do. Thank you for all the innovations, and best of luck to all of you in the competition.
All right, congratulations to Viz AI. And we do ask for your patience tonight. It's been a key quality throughout this pandemic. We're bringing in literally more than 120 people via Zoom. And so you'll get the occasional dog barking, you'll get occasional audio issues. Now we just need some kids to run into some of the shots and then we'll be good. All right, our third category tonight recognizes the best telemedicine product or service for improving patient outcomes. This award is sponsored by NTT VC, and presenting for this category are founder of NTT Venture Capital, Vab Goel, and Lindy Fishburne, the managing partner of Breakout Ventures. Presenters, you are on.
Good evening, and thank you UCSF Health Club for hosting tonight's event. I'm Vab Goel, founding partner of NTT VC. It is a great honor to be here and talk to you all about next award category, telehealth. Telehealth has never been more vital than it is right now. As the pandemic unfolds, we are seeing innovators, entrepreneurs create novel ways for healthcare to be accessed and delivered. This is an opportunity for startup companies, large companies to set their sight beyond the pandemic to change how health systems operate on micro levels. Telehealth has the potential to bridge the gap in healthcare so anyone, no matter where you are in the world, has access to the best expertise and care. Our team at NTT VC has spent a great deal of time immersing ourselves in the world of telehealth. I have seen firsthand how the telehealth companies of today's are empowering and changing the way hospitals, healthcare communicate with, screen, monitor, and treat patients. As we have made multiple investments in this area, I'm just excited about that how telehealth can make a positive impact in the healthcare system. And now, without any more delays, to Lindy for announcing the winners in telehealth.
Thank you, Vab. I'm Lindy Fishburne, managing partner of Breakout Ventures. We invest at the intersection of technology and biology, and so our relationship with UCSF and the team that's put on this amazing award show tonight is very important to us. And we want to thank Mark and HealthHub for all the coordination and for shining a light on digital health and how we're actually finding ways to empower patients with access and data, and these companies are bringing that into fruition. If we were together tonight, I'd ask for a show of hands as to how many people with us use telehealth for the first time during the pandemic. I think for all of the disruption and devastation, one of the bright lights that will come out of this situation is the acceptance and the reimbursement of telehealth as one of our real lasting positive outcomes. And I think the stock market appears to agree also. So without further ado, I'm pleased to announce the finalists in the Telehealth Award category include Hazel Health, represented tonight by Jenny Chin, Head of Clinical Ops and People, ZocDoc, represented by Jessica Appman, Chief Communications Officer and Chief of Staff, GoodRx, represented by John Azalone, General Manager, and Amwell, represented by Webster Brim, Director of Corporate Marketing.
Lindy, can you please announce the winner? The suspense is killing me.
Without any further ado, ripping open, GoodRx is the winner, and we'll be accepting, and we'll hear a few words from John Aslan. Congratulations on the award and the great week that GoodRx has had.
Just go to goodrx.com, and with a few clicks, you'll be treated by a licensed medical professional, all from the comfort of your own home. Visits are confidential and affordable. Need a prescription? Your doctor can send it to your pharmacy or have it mailed to you. Get the healthcare you deserve at goodrx.com.
Thank you very much, UCSF. We greatly appreciate the honor. GoodRx was founded 9 years ago to make it easier for consumers to compare prices for drugs. That's where we started. Last year, we launched telehealth with the launch of Hey Doctor by GoodRx, just make it simple and easy for consumers to compare prices and talk to a doctor. We're really happy to be nationwide and be focused on driving down costs for consumers. We believe that every consumer should have access to affordable, safe, convenient, high-quality healthcare. And we know and we believe that if we can lower the prices, more people will have access to it. Again, thank you so much for the recognition. Thank you for the UCSF community. We appreciate everything people here are doing to make healthcare better for all people. Thank you.
I'm president and CEO of UCSF Health, and I want to thank all of you for participating in the UCSF Digital Health Awards. You know, even before COVID hit, and certainly long after, technology transformation of how we deliver healthcare is essential to improving quality of care, to improving safety, to improving patient experience, and dealing with long unaddressed issues like healthcare disparities. So I just want to let you know, we're counting on you. We need you, and we are going to be there to support you and your creativity as you develop new products and new solutions to improve the U.S. healthcare system. Thanks again, everybody, and welcome.
The UCSF Digital Health Awards wishes to extend our deepest thanks to our medical heroes and to the corporations that have contributed their best industrial know-how to combat this pandemic. It is the continued entrepreneurial spirit that guides us all to greatness and safety. These awards were designed to honor that very heroic spirit. May our great works always provide a shining light, even in darkest times. Stay safe, wear your mask, keep your distance. The Digital Health Awards is proud to introduce Dr. Bob Wachter, the professor and chair of the University of California, San Francisco's Department of Medicine and UCSF's COVID spokesperson. He is recognized for his role in providing the public with transparency and leadership by communicating factual information through social media channels and opening up the university's Department of Medicine grand rounds to the public on YouTube. Welcome, Dr. Bob Wachter.
Thank you to the UCSF HealthHub. Thank you to Mark and to Barry for this opportunity, and to Twee for improvising so well. Doing this with Zoom adds about 1,000 degrees of difficulty, so appreciate all of you being here. It's an honor to introduce this category and take a moment to reflect. Yesterday was a profoundly sad day in the United States as we hit the 200,000 mark for deaths from COVID-19. It's a number that's hard to get your arms around, so let me try to give you a few things that make it feel more real. That's the entire population of Salt Lake City. That's the equivalent of 2 completely filled University of Michigan football stadiums. That's the equivalent of 5 years of deaths from influenza in the United States. And that's the equivalent of 67 September 11ths. If you think about that, and each life has value, each life is someone who is loved, it's really remarkable what we've all gone through. The true heroes of COVID-19 are my colleagues throughout the country and around the world who've been on the front lines. But digital innovation has been a pivotal contributor and continues to be a really important part of our efforts to improve the care of patients with COVID. We've seen rapid and amazing efforts to build accurate diagnostic testing, which became even more crucial as we learned about COVID's superpower, one of which is the propensity to cause asymptomatic infection and transmission. Probably the most enduring innovation is the one you just heard about, is going to be telemedicine. And I got to see its true value when my palliative care colleagues began performing consultations on patients who were dying and dealing with their families as well. While they were here in San Francisco, they were doing consults on patients in New York City, helping to relieve their absolutely overwhelmed colleagues in New York City. So many UCSF physicians and nurses went to New York City, went to the Navajo Nation, but a lot of the work that we did was through telemedicine, which was extraordinarily gratifying and demonstrated the value of the technology. We also saw advances in apps that helped us organize our workforce and our workflow, apps that helped screen us for symptoms before we came into work, We also saw remarkable websites that gave us timely data on COVID cases and deaths and test positivity and PPE and hospital capacity, data that informed decisions by healthcare organizations and policymakers. I have to say that I've been tweeting since the pandemic began, and these tweets have been viewed by more than 50 million people. And the way I construct the tweets is I go to the web and go to many of these websites and look for data that help inform me about what the state of the pandemic is, both in San Francisco, around the country, and around the world. As you go to these websites, many of the tools employed breathtaking data visualization techniques that previously we saw in other walks of life but have not seen in healthcare until now. And they put to use new sources of data, such as cell phone-based movement data, or digital temperatures, or even open table reservations to tell us whether people were going to restaurants. Well, they say that necessity is the mother of invention, and COVID is the mother of necessity creation. The companies you'll hear about tonight filled some crucial gaps, often pivoting from their core business models because they recognized a key need and they knew it was the right thing to do. We have 3 categories of COVID awards to present tonight: the best diagnostic testing solution, the best patient engagement solution, and the best delivery and decision support solution. I've always thought our infectious disease doctors were awesome, but during COVID, they became rock stars as we turned to them all the time for wisdom, experience, facts, and recommendations, and sometimes just hand-holding. One of the best is my UCSF colleague, Sarah Dornberg, who will present the award for diagnostic testing. Sarah.
Thanks, Bob. As we spoke before, you reminded me of the early days before we really had widespread diagnostic testing for COVID. We had these super complex algorithms required to figure out who could get a test and who couldn't. And then the COVID ID attending had to decide who came off isolation in the end. This was not a fun job. Widespread testing has really changed this. It has allowed us to bring patients back to the hospital for necessary treatments like cancer chemotherapy and surgeries that will change their life if not deemed essential. It has allowed our workforce to return back to the hospital and feel safe at the hospital at work. It has allowed us to link COVID-19 patients to treatments and to research studies so we can better figure out how to deal with this pandemic. I know things will continue to improve thanks to the innovation that you all are doing. And I really hope that one day in the near future, I can look back on today and remember how far we've come from now. So now I'd like to present the finalists in the COVID Patriot category, Best Diagnostic Testing Solution. The finalists are Mammoth Biosciences, represented by Trevor Martin, CEO and co-founder; Scanwell, represented by Stephen Chen, CEO; OneHealth.io, represented by Nikhil Arun, VP of Product; and Color. And the winner of the Best Diagnostic Testing Solution for 2020 is Mammoth Biosciences, represented by Trevor Martin, CEO and co-founder. Congratulations.
The detection of one tiny genetic sequence tells a mammoth story, one with a multitude of customizable applications across healthcare and industry. Mammoth Biosciences, bringing CRISPR out of the lab and into everyday life.
Hi, congratulations to Mammoth Biosciences. You are on.
Super honored to even be considered for this, and all the other companies are doing an amazing job as well in fighting what is really one of the defining kind of characteristics of our time, which is this pandemic. So we're just really happy that we can leverage a tool that has made huge splashes in biology in the editing field, but now leveraging it in the diagnostic field. And at Mammoth, we're just really excited about building these new technologies on top of CRISPR. So we're very honored and excited that we can contribute.
Hello, everyone. My name is Mike Dowling. I'm President and CEO of Northwell Health. Healthcare, as you all know, is a special and unique business, a business in which we should all feel incredibly grateful and proud to have the honor of working in. This uniqueness was clearly demonstrated in our experience over the past 6 months during the COVID-19 pandemic. In treating more than 1,000 COVID patients overall and 17,000 inpatients during this time frame. Digital health has proven to be an indispensable asset. It's a pleasure to have this opportunity to talk to you briefly. I thank you all, and thank you.
Partner at the venture capital firm Venrock, but relevant to this category, spent much of the COVID-19 pandemic in Sacramento, helping our state respond and leading a lot of the work to scale up testing. And I've spoken to many of the companies that we're honoring tonight and can speak to the awesomeness in how they responded. And we should all be grateful as Californians and Americans for them stepping up at a time when we really needed them. Tonight, I'm presenting the category of Best Patient Engagement Solution. The finalists tonight are Consejo Sano, represented by Abner Mason, CEO, Doctor on Demand, represented by Dr. Ian Tong, Chief Medical Officer, Luma Health, represented by Aditya Bansad, co-founder and CTO, and GoodRx, represented by John Assaloni, General Manager. The winner for the Best Patient Engagement Solution for 2020 is Consejo Sano, represented by Abner Mason. Abner?
My name is Abner Mason, and I'm founder and CEO for Consejo Sano. I'm honored to accept this award. I want to thank the UCSF HealthHub and the whole Digital Health Awards team for all your work putting the awards program together. I want to acknowledge all the other fantastic companies in this category and in all the other categories. And most importantly, I want to thank the Consejo Sano team for all the work you do and for your commitment to making sure our healthcare system works for everyone who calls this country home, regardless of what they look like, what they talk like, or where they come from.
Consejo Sano is a curated, omni-channel, culturally aligned engagement experience. We utilize technology and cultural alignment to improve patient outcomes, lower costs, and increase revenue for plans and providers.
I'm Amy Abernathy, Principal Deputy Commissioner and Acting Chief Information Officer at the USF DNA. I'm delighted to join you to celebrate this event. Digital health and innovation hold a spot near and dear to my heart. As we strive together to build a learning healthcare system, we need interoperable data ready for real-time analysis, innovative devices and software solutions, and creative algorithms that put data to work. This, plus aligned regulatory approaches to ensure quality and public trust. Innovators, thank you. It's important.
And now back to Sarah.
Thank you. So in the COVID Patriot Award category, Best Delivery and Decision Support, the finalists are Carbon Health, represented by Erin Bali, co-founder and CEO, CareMerge, represented by Fahad Aziz, co-founder, Qventus, represented by Greg Schneider, Chief Marketing Officer, and Gluco, represented by Russ Johannesson, CEO. And the winner of the Best Delivery and Decision Support for 2020 is Carbon Health, represented by Erin Bali, co-founder and CEO. Congratulations.
We are Carbon Health, a tech-enabled healthcare provider who has been at the forefront of this pandemic. With COVID Ready, our program helping companies to remain open safely, and testing at our clinics and pop-ups across the country, we stand by our mission to make healthcare accessible for all.
Hello, I am Cesar Javaharian, Chief Clinical Innovation Officer and co-founder of Carbon Health. I'd like to thank UCSF HealthHub for awarding Carbon Health first place in the COVID Patriots category for Best Delivery and Decision Support Solution. On behalf of the entire Carbon Health family, thank you for this honor, recognizing our team for the tremendous hard work and dedication that they provided to create and deliver the digital health tools and form the clinical expertise to address this devastating pandemic. We are driven by our goal to increase access to affordable world-class healthcare in communities around the country. Thank you.
Okay. Well, thank you so much to Dr. Bob Wachter, whom you heard from earlier, and also to Sarah Dornberg and Dr. Bob Coker for presenting our COVID Heroes categories. So we're going to move on at this point, and our next category is for the best product or service for remote patient diagnostics. Presenting tonight are Dr. Daniel Kraft, the founder of Digital.Health, and Ann Wellington, managing director of the Cedars-Sinai Accelerator Program. Welcome to you both.
Okay, thanks very much. Before I kick off the digital best remote diagnostics category, a bit of a special announcement. It's exemplified by all the terrific companies here this evening. We've got a really rapidly expanding array of innovative digital health solutions that are disposal today and in the pipeline, addressing pain points across the healthcare continuum. The challenge is making sense of all of these and to identify and utilize these emerging tools and solutions. So I recently founded Digital.Health, that's the domain name, to address this challenge. And I'm incredibly excited to announce that Digital.Health is partnering with UCSF HealthHub to build the ultimate digital health data company and solutions repository. A one-stop go-to resource to find the best available digital health tools, solutions, and resources, a bit of a digital health formulary enabling everyone from clinicians, payers, care systems, pharmacies, to clinical trialists to identify from the widening array of apps, devices, services that match the patients, clinicians, and systems needs. So thanks to UCSF HealthHub for the partnership. Check out Digital.Health. It'll soon be evolving from its basic 1.0 version, and sign up now to join us. And now on to our remote diagnostics category. So first, thanks to UCSF HealthHub, Mark and team, and the incredible companies who've been competing. I was a judge last year and again this year, and really impressed by the accelerating innovation and impact. I know in my experience as a physician and as a patient, we spend so much of our time, effort, and dollars struggling to obtain the currency of medicine, data, and then struggling to extract the actionable information we can glean from this to impact prevention, diagnostics, and therapy. So unfortunately, we've arrived in the future, 2020. We're still using fax machines, paper forms, DVD-ROMs to record, contain, and share much of this information. And this has really facilitated and continued our sick care model, intermittent data, traditionally only collected within the four walls of the clinic or hospital, and leading to our reactive sick care model, where we diagnose disease late. We tend to wait for the patients to present with a heart attack, stroke, or advanced stage cancers. I founded and chair a program called Exponential Medicine that explores the convergence of many fast-moving technologies, from low-cost sensors, Internet of Medical Things, big data, and AI, and their opportunities to reshape health and biomedicine. And many of these technologies and convergent innovations and platforms are emerging to actually actualize the shift to continuous, connected, proactive, contextualized, data and insight-driven healthcare outside of traditional four walls that can leverage virtualized care anytime, anywhere at lower cost with more convenience, earlier diagnostics, more personalized care, and better outcomes. And this remote diagnostics and remote sort of patient monitoring, RPM world, is at the center of this shift, catalyzed by new reimbursement models, virtualized care, and COVID, bringing us from hospital to home or hospital to hospital, and dramatically improving insights into our patients' hearts, behaviors, functional status, and to detect and monitor disease. And so now I'm going to hand it over to Ann Wellington, the managing director of Cedars-Sinai Accelerator down in Los Angeles, and she's going to present the semifinalists and announce the winner. Over to you, Ann.
Great. Thank you so much, Daniel. And hello, fellow healthcare nerds. I think in the past several months, we've really seen more than ever, as Daniel said, the power of remote diagnostics to help provide great care for patients. And certainly these solutions were critical and will continue to be critical in helping healthcare providers really meet the moment of converting rapidly to doing a lot more remote patient care. Looking ahead, I'm certain that in the months and years to come, we'll see healthcare really revolutionized by the companies we're honoring tonight and many others in this space. In the Remote Diagnostics Award category, the 2020 finalists are iRhythm, represented tonight by CEO and President Kevin King; Barty Diagnostics, represented by Vice President of Sales Bobby Cockrell; Conversa Health, represented by CEO Murray Brzezinski; and Circadia Health, represented by CEO Faris Siddiqui.
Virtual drum roll. The winner is Conversa.
Conversa is healthcare's automated virtual care platform, delivering personalized remote care and communication so health systems can manage, monitor, and engage their patient populations at scale more efficiently than ever before. Conversa, personalized automated virtual care.
Wow. Thank you, UCSF Health Awards, and congratulations to the other really great finalists. I'm thrilled to accept this award on behalf of the dedicated team at Conversa who works tirelessly to make sure that automated virtual care becomes the standard of care. And I have to say this team really met the moment when COVID hit. And also to the real heroes, the frontline healthcare workers at UCSF and Northwell, Prisma Health, University Hospitals, UNC Health, and so many others that use the Conversa platform every day to extend access to healthcare, to enhance the patient experience, and to improve health outcomes. This is for you. Thank you.
Hello, everyone. I'm Alex Gorski, the Chairman and CEO of Johnson & Johnson. As the world's largest, most broadly based healthcare company, developing innovative digital solutions is essential to achieving our purpose of improving human health. This is true now more than ever, as we work to tackle the most pressing global public health crisis of our lifetime, COVID-19. At Johnson & Johnson, we're absolutely committed to investing in innovation, expanding our digital capabilities, and collaborating with leading technology companies so we can continue to meet the evolving needs of our most important stakeholders, patients, doctors, nurses, and all those we serve.
All right, let's move on to our next category now. It is for Best Digital Product or Solution for Hospital and Clinical Diagnostics. We have Paul Grand, the CEO of MedTech Innovator, and Dr. Daniel Burnett, the founder and CEO of Theranova, presenting for this category.
Thank you, Mark, and to the team at UCSF HealthHub for organizing this great event. I myself have put on many virtual events, and I can appreciate how much work it takes to do this right, and you guys are doing a terrific job. I think all of us have been impacted in some way by hospital diagnostics. I personally have veins that are incredibly hard to access, so I'm always looking for innovation in that space. And whether this is that annual blood draw during my physical, or it's an ultrasound that determined my appendix was about to rupture, or that my 3 daughters were developing properly while still in utero, or the lump on my leg was nothing to worry about, or that I didn't have a mitral valve prolapse. I think you get the picture. All of us are impacted by hospital diagnostics in a very personal way. And I think all of us know someone who's been diagnosed with the disease and understands how personal and how important it is to have rapid, clear, impactful diagnostics. And as important as hospital diagnostics have always been, the past 6 months of the pandemic have really shown a spotlight on how critical it is to have innovations that improve not only safety for patients, but also for caregivers, that reduce the need for PPEs, that provide rapid results, that allow for early detection, and that are digitally enabled to facilitate remote care. And at MedTech Innovator, we believe strongly that hospital and health innovators need our support to succeed. And I'm extremely honored to be part of this event, which provides such high-profile visibility to 4 of the leaders in the hospital diagnostics space. I'm also very proud to be sitting side by side with Dr. Daniel Burnett, who himself is such an incredible leader in this field. So I'm going to hand it off to Dan now to announce the semifinalists and the winner in the hospital diagnostics category. Dan.
Thanks, Paul. This certainly is an exciting category in a very hot space, with a continuous push for less invasive diagnostics and the recent drive to move hospital-grade monitoring into the home due to COVID-19. My name is Dan Burnett, and I'm the CEO of Theranova. We have a medical device incubator where we develop digital health technologies that share something in common with all 4 of these companies: the triple aim of improving outcomes, reducing costs, and expanding access in healthcare. All 4 of these companies are remarkable and will achieve great things, but only one can come away with the UCSF HealthHub Hospital Diagnostics Category Award. The finalists are HeartFlow, Charlie Taylor; Echo, Jason Bellett. Zebra Medical Vision, Ohad Arazi. And Grail, Joshua Offman. And the winner in the HD category for 2020 is, just kidding, I didn't freeze, Echo. Congratulations, Echo. The award will now be accepted by Ohad Arazi.
Congratulations, Echo. Thank you so much.
At Echo, we're on a mission to help healthcare providers identify cardiovascular disease, the world's #1 killer, earlier and on the front lines of care. We've turned the iconic stethoscope into a powerful AI-enabled digital tool that alerts providers to potentially life-threatening cardiac conditions during the physical exam. Thank you so much for this recognition and for fostering a digital health community that has supported Echo every step of the way. Together, we can elevate the standard of cardiac screening in communities around the world. Thank you.
Hello, everyone. My name is Malik Majmudar. I'm a cardiologist and principal medical officer of Amazon Halo, a recently announced health membership service from Amazon. First of all, I would like to say thank you to all the entrepreneurs and my congratulations to the semifinalists and finalists. The COVID-19 global pandemic has really demonstrated the need for more convenient, accessible, affordable, and equitable health solutions. To borrow a few words from Amazon's leadership principles, thank you for your customer obsession, your ability to think big, and your bias for action to solve some really pressing healthcare challenges. Be well.
All right, let's move on now. And presenting for Best New Digital Health Product or Service helping patients and providers save money will be Dr. Craig Monroe, Associate Chief for Clinical Innovation for the UCSF Health Gastrointestinal Division, and Sandra Duncan of LifeForce Capital.
Hi, everyone. I first want to thank the UCSF HealthHub and Mark Goldstein for the opportunity to judge and present on this very important category, patient cost savings. My name is Craig Monroe, and I'm an interventional gastroenterologist and the Associate Chief of Clinical Innovation for the UCSF Health GI Division. Cost-effective care is one of the defining problems of our times and a core issue that needs to be solved for the health of our country. As you know, in 2018, the United States spent $3.6 trillion on healthcare, or 18% of our GDP. As technologies develop, or we simply want to deliver high quality care into our community, the multiplier effect for adoption will be cost to patients and payers, not just the product offering. As a practicing clinician, it's really unacceptable that patients should have to choose between the health of themselves and their families and their finances. And make no mistake about it, these issues are amplified due to COVID-19. The US has shed nearly 30 million jobs since mid-March, and so the cost now presents a real risk of instigating a public health crisis. The importance for the companies such as the ones that have been nominated tonight to engage our legacy systems and create efficiencies really cannot be overstated. For me, it's a privilege to work in the UCSF hospital system, which represents one of California's 21 public healthcare systems. Despite making up just 6% of all the hospitals in the state, these 21 hospitals provide 40% of all the hospital care to California's uninsured and train half of the new doctors in the state. Being good stewards of financial resources and applying them equitably is obviously of highest importance. So to finalize, I just want to congratulate all of the companies, not just the winners, on pursuing a mission-driven focus to try to solve a seemingly intractable problem. In reviewing the incredible work of your companies, I'm hopeful for the future. And now a few words from Sandra, who will present the semifinalists and announce the winner.
Great, thank you, Dr. Monroe. My name is Sander. I'm a general partner at Lifeforce Capital, where we focus exclusively on financing software-driven innovation in healthcare. So I know it'll be stunning to hear a venture capitalist admit he doesn't know something, but I don't know how to fix the complex issues underpinning patients' cost burden. That's despite spending the last decade or so as an investor and operator in digital health, where the paramount importance of cost reduction has been paneled, blogged, business planned, and pitched extensively. But entering my second decade now in digital health, I feel the tide turning ever so slightly and momentum building just a bit. The industry is maturing, and the first generation of founders and companies that have been at it for years are starting to move frameworks and incumbents in the right direction. Does that mean we have finally cracked the code on patient cost savings? I don't know. But these 4 special companies just might have the answer. In the Patient Cost Savings Award category, the finalists are Innovaccer, represented today by Dr. David Nace, Chief Medical Officer. Sword Health, represented by Anna McGuy-Sim, Chief Marketing Officer. Advocacia Solutions, represented by Laura Robbins, Chief Operating Officer. And last but not least, Karam Health, represented by Brett Nicholson, co-founder and Chief Customer Officer. And the winner of Patient Cost Savings Award for 2020 is Advocacia. Congratulations. Laura is here to accept the award on behalf of her team at Advocacia.
Ryan Brebner, CEO and co-founder of Advocacia. Our technology engages, assists, and enrolls the uninsured and underinsured to benefits. We increase reimbursement and reduce bad debt by delivering the confidence that every individual is connected to the resources and the programs they qualify for.
Thank you, everyone. We're extremely honored to accept this award in patient cost savings, especially given the highly competitive organizations that were in this category. I just really want to take a moment to thank UCSF for putting together this virtual event and bringing a little bit of a light to 2020, and learning a lot about different organizations was very beneficial for us, as well as the judges. Thank you so much for dedicating your time to review all of the organizations. And most of all, to our team for allowing us to have an impact across the country for the uninsured and underinsured, and continue our work to help hospitals increase their reimbursement and decrease their bad debt while assisting our most vulnerable population, especially during these times when access to care and coverage is so important. Thank you again.
Okay, we are ready now for category number 8. Please welcome the co-founder of the UCSF Center for Digital Health Innovation, Dr. Einar Sawyer, and the founding partner of Hike Ventures, Mikihiro Yasuda, to present for our best new wellness digital health product or service aimed at consumers.
Thank you very much for the opportunity. My name is Einar Sawyer, and I'd like to thank HealthHub for all the fantastic work they've done in curating and down selecting to these extraordinary companies in the category of consumer wellness. Across my entire career, from physical therapy to exercise physiology to orthopedics, I've always been interested in empowering patients in their self-health. My interests in this were, of course, heightened when caring for my disabled father at home for 10 years and then in my own cancer care. I've deployed these lessons in innovative remote technologies in now covering solo ocean rowers and in my new role with NASA and Trish planning health and medical strategies for astronauts on low Earth orbit, cislunar, and deep space missions, which is really the edge case, the true edge case for remote medicine. However, there's little need for me to explain the importance of this category to you, as in 2020, we all enrolled in an unconsented global public health trial, and we are existing in a, quote, living laboratory that has truly challenged our abilities around self-health and has exposed critical needs in remote healthcare delivery. The importance of consumer wellness capabilities has really hit home for everyone, whether you're responsible for your or your family's well-being, whether you're a healthcare provider striving to care for patients, or you're helping to rapidly deploy public surveillance tools to characterize and react effectively to a highly contagious and deadly virus that's moving through our communities, or you are a health transformer, contributing to the development of new solutions to enable all of the above. From any of these perspectives, you've realized the clear need for remote and individual wellness solutions, such as those in this category that provide remote assessment, analysis, and action in real-world environments, or in what I call our life flow. That is where we, or those we hope to benefit, do actually exist. The pandemic-associated restrictions on in-person services forced limited access to traditional models of highly resourced care in centralized locations. And this has highlighted major gaps in capabilities and helped to laser focus the opportunities in achieving distributed but not diluted healthcare. Innovative consumer wellness capabilities integrated into the complex tapestry of healthcare will allow a full spectrum of delivered to augmented to autonomous health and medical management. I'm really grateful to the companies in this category because they will help us realize the universal goal of informed health, where you receive the right information at the right time to make the right choice and obtain the optimal outcome. For ourselves and for those we care for at home, in the community, in hospitals, or in the middle of the Pacific, or on a mission to Mars. Please now let me introduce my colleague, Miki Yasuda, who will announce the finalists and the winner of the consumer wellness category.
Thank you, Ainor. Hi, my name is Mikihiro Yasuda, founding partner at Hike Ventures. At Hike Ventures, we invest in applied AI startups, including healthcare. Personally, I've been witnessing how startups are using technology to quantify consumers' health status and also help the healthcare system optimize the operation to provide a better care to patients. With that, I'd like to introduce the finalists in the Consumer Wellness Award category. Here we have Enso, represented by Sean Rahimi, founder and CEO, and the Aura, represented by Harpreet Sai, CEO, Auto Pharmacy, represented by Hannah Bayam, Marketing Director, and then Aviation, represented by Jen Liao, Head of Strategic Initiative and Achievement. And the winner in the Consumer Wellness category for 2020 is Aura. Congratulations.
I'm assuming you guys can hear me. Look, I just want to say, obviously honored to receive this award on behalf of many. Wanted to thank our users, who not only make up our community, but have also shared their data with, this research together during this pandemic. The UCSF HealthHub and also Dr. Ashley Mason and Dr. Rick Hite and their team. All of us at Aura, who I know worked tirelessly to be the first wearable out there on a study during a pandemic, was really inspiring even for me to see.
So awesome job on our team pulling together. And frankly, all of our frontline healthcare workers that are keeping us safe during this time. And we're here to make the world a better place, a healthier place, and a safer place. And we're excited to do our part, but it's not just us, it's all of us together, every company here across all these categories, and we're all making it happen together. And at Aura, we're just, we're really honored and proud to be part of that mission. So thank you. Oh, and wait, thanks Mom, Dad, and Sarah and Lola. You guys rock.
All right, congratulations to Aura. Our next category is consumer prevention. It recognizes the best digital health product or solution, helping to keep patients, keep diseases at bay. This award is sponsored by Biome by Novartis, and presenting in this category is Dr. Urmimala Sarkar, Associate Director of the UCSF Center for Vulnerable Populations, and also Steve Barsh, Managing Partner at Dream It Ventures.
It's time to come together, to combine years of experience with cutting-edge technology, scientific expertise with entrepreneurial spirit. Let's bring science, data, and tech together to create sustainable and scalable digital solutions for patients. Introducing the Novartis Biome, a global network of innovation hubs aimed at strengthening the connection between Novartis business teams and partners from across the health tech ecosystem, from nimble startups and academia to the biggest players in the industry. The Novartis Biome is a bridge, accelerating ideas and solutions with customized residency programs, mentorships with internal experts, and access to data, resources, and experience of one of the leading healthcare companies in the world. When passionate people join forces, they can shake up an industry and reimagine medicine.
Thank you for inviting me to the UCSF Digital Health Awards. My name is Robin Roberts, and I'm one of the co-founders of the Novartis Biome. I'm also its Chief Operating Officer and Head of Strategy. The Novartis Biome is an organization within Novartis that is designed to engage with the digital health ecosystem. We do this by bringing real-world problems from our business units and patients to you, to give you the opportunity to solve those problems. I want to congratulate tonight's winners and really look forward to working with you in the near future.
Hi, everyone. It's such an honor to be here. I'm a professor of medicine at UCSF and have the privilege of studying digital health. And I'm so impressed with all of the finalists in this category of consumer prevention. The award category of prevention resonates really strongly with me because I practice primary care at San Francisco General Hospital. Every time I go into the clinic, I see many preventable conditions. And I know that when my patients and their families can take charge of their health in their everyday lives, we can keep people healthy instead of only treating disease. Now, physicians have been saying this since the time of Hippocrates, but we still don't have all the answers. Seeing all of the innovations in this space makes me optimistic about the future of prevention. And now I'll hand it over to Steve Barsh as he will present the finalists and announce the winner.
Hi, thanks for having me. Steve Barsh from Dream It Ventures. I just want to say briefly, consumer prevention I find is very important to me personally. The reason why I think it's hard. Consumer prevention is very, very hard. When you meet a doctor, like the person in front of us, like how many times do you see your doctor and they're saying, wear your seatbelt, watch your diet, exercise, stop smoking, stop drinking. These are all consumer prevention things, but they're very difficult for people to do. So I find it a very compelling category because if we do all the right things, we wouldn't have as many problems. So it's a very tricky issue to deal with. Anyway, I wanted to be the person to go ahead and tell you about the Consumer Prevention Award category. And first of all, who the finalists are. And the finalists are surgical theater, Podometrics, Dexcom, and Carrot. Okay, so now let me tell you who the winner is. And the winner of the Consumer Prevention 2020 category is, here comes the rep, just in case the virtual one didn't work, Dexcom. And congratulations, Dexcom. And accepting for Dexcom is Matt Dolan, Senior Vice President and General Manager of New Markets.
The Dexcom tells me my numbers every 5 minutes, and it also tells me which way I'm going.
I can just look at my phone and see my numbers in real time.
It's like the easiest app in the world, and you don't have to prick your fingers at all. It's amazing.
Congratulations to Dexcom and your team.
Yeah, thank you so much. And thanks for the honor here today and bringing to light all the great technologies that were a part of this process. I think it's an important work. You know, at Dexcom, our growth has really been fueled by a focus on driving our sensor technology to where it's becoming clear that it should be instrumental across healthcare, you know, including for the purposes of prevention, which is appropriate to this category. I just want to say a couple words on our mission. We've always focused on the patient from day one, and our employees are driven by that mission every day. We hear incredible stories from our customers on how we either change or even save their lives. So humbled to be here, humbled to represent our employees. Seeing the early wins that we are in type 2 and remote patient monitoring will only motivate us further to keep driving that impact and that our company can make on those lives for many years to come. So thanks again, and appreciate this platform.
All right, our next category recognizes the best digital health product or service for enabling better mental and behavioral health and wellness. Presenting this award, we welcome Dr. Atul Butte. Dr. Butte is the Priscilla Chan and Mark Zuckerberg Distinguished Professor and Inaugural Director of the Baker Computational Health Sciences Institute at the University of California, San Francisco. He is a strong advocate for digital health and has launched a number of Silicon Valley-backed companies in this field. Dr. Butte will be presenting together with Christine Aylward, founder and managing partner at Magnetic Ventures.
Thank you. Thank you to the UCSF HealthHub and UCSF for allowing me to present the award for the most promising digital solution for mental and behavioral health. I serve on the advisory board of the HealthHub, and I love to see all the exciting companies at the forefront of digital health innovation. Now, my co-presenter and I will be talking about mental health and all of the issues surrounding behavioral health. Just this month, a paper came out in JAMA discussing the prevalence of depression symptoms in American adults during the COVID-19 pandemic. So we know mental health concerns are everywhere. We're now 6 months into the pandemic, and we all have friends, family, and coworkers who are struggling with mental health and mental illness. For me personally, I'm faced with the challenge of work-life balance on an everyday basis. So it is not hard to understand the importance of mental and behavioral needs. Even though we can all check in with colleagues to look out for problems of mental exhaustion or psychological pain, there's still an urgent need for more personalized apps in the hopes of looking out for ourselves and for one another. On a larger scale, it's not just a moral, but also a financial imperative for us to advance tools for mental and behavioral health. Every year, nearly 20% of the adult population struggles somehow with mental health, with about $200 billion of lost productivity due to mental health problems in the workforce. And that was before the pandemic. For these reasons, I am excited to see the work being done by the finalists for the Best Mental and Behavioral Health Award. My co-presenter, Christine, will be discussing the finalists in a moment. But let me just close by stating that I love these companies are developing apps and tools to connect users with medical and mental health professionals and resources. Our finalists are providing personalized programs, regimens, and apps to revolutionize the care of mental health. Now I'm turning this over to Christine Aylward over there, as she will announce the finalists and winner in the mental and behavioral health category.
Thank you, Atul. And I'd also like to say thank you to UCSF for everything that you're doing to pioneer digital health. When I think about mental health, I think about a few things. I think there's a lot of stigma around mental health that there shouldn't be. It's a disease like any other disease, including cancer. When we think about how we impact mental health, technology, in my humble opinion, will truly be the game-changing factor to mental health. My fund, Magnetic Ventures, invests at the intersection of life science and technology, but I spent my early career. You know, it takes a lot of courage to go out and start a company in a sector that's not yet proven. And I think the people, the companies in this sector have really taken a big, bold step towards making major advancements in mental health. So I'd like to thank you for that. And with that, I will announce the companies, Big Health, represented by Peter Hames, the founder and CEO.
So the finalists, as you just heard, are Ginger, Big Health, Doctor on Demand, and Silver Cloud. And are you guys ready to hear who the winner is? Here we go. The virtual envelope has just been handed to me. It is Ginger.
Thank you so much. You know, Ginger is completely focused on solving the supply-demand imbalance in mental health. There are far more people that need care than have access to it today. And we want to make the world a place where mental health is never an obstacle. So thank you to UCSF for recognizing not just Ginger, but all of these incredible companies who are doing great work to try to solve this problem together for the world. I also want to thank our co-founders, Karin and Anmol, for the vision and the hard work to get here. Some of our early investors like Khosla and Kaiser Permanente, who's believed in this and allowed us to get to this position. Some newer investors like HVC and WP Global and Bessemer Ventures, Cigna, who just joined our round. Some of our customers like Delta Airlines and SurveyMonkey, Sephora, who have come with us on this journey to help provide real-time access to their employees. And finally, last but not least, this is hard work. So all the employees of Ginger, and particularly our coaches, our clinicians, our therapists and psychiatrists that are doing immensely great work to support everybody that needs support right now. Thank you very much.
And I'm the president of Verily Health Platforms, and I also serve as a lecturer at Harvard Medical School. I think we're really appreciating just how critical digital health is. It's really turning out to be ubiquitous. So many of the companies here are helping patients, their families, and clinicians co-produce health. At Verily, we're doing just that. We're using sensors like continuous glucose monitors to move healthcare from a one-size-fits-all to a personalized experience. And at the same time, the challenge for all of us is to address the business model. Let's not charge for every click and every text, but get paid for making people healthier and deliver the science and the evidence to prove it. So congratulations to all the winners. Sorry we couldn't be there, but stay well and strong and keep on innovating.
All right, our last technology category honors employer wellness. And presenting in this category will be Dr. Archana Dubey, the Global Medical Director with HP, and Kyle Louie, partner with DCM Ventures.
Excellent. So first of all, I want to congratulate Mark and his team to host this virtual event. It has been a pretty popular event in the past years, and to be able to scale it on the virtual platform is immense, and congratulations everyone here. Thank you so much UCSF Hub, UCSF innovators, and fellow presenters, including Kylie here, for inviting me and hosting this fantastic event, especially acknowledging that you have truly made UCSF Hub as a platform for digital health innovation. And now more than ever, we need innovation. We needed a reason to disrupt healthcare, and COVID-19 is here. So let's all join hands and disrupt healthcare for a better experience for our patients. I am delighted to present this for this category because as a global medical director for a large company at HP and also a clinician, a practicing clinician, as a medical leader at Crossover Health, I see the impact of employee health and well-being innovation in my patients and scale all the way to my population health outcomes. I believe to solve for care and cost issues, we need more innovation using a digital technology in the employer health and well-being space. Especially during this pandemic, we noticed that we were able to use technology and digital innovation to bridge the gap that was left open by public health resources that we all witnessed. And solutions like COVID care program that Crossover built for our population, Crossover Health built for our population, solutions like contact tracing that we noticed in international arenas were extremely valuable for our population. We want to see more of these innovations happen. Kaiser Family Foundation 2019 found that why do I care? Why do we all care about employee wellness? Here's the reason why. 82% of individuals are covered by employer health, employer insurance, and 70% of families are covered by it. So it matters and it touches all of our lives. So any innovation that you do in the employer health space goes directly to each one of us. I have seen the impact of that in our clinical outcomes. I've seen the impact of that in the well-being and thriving workforce for HP population. We see decreasing absenteeism, presenteeism. We also see decreasing cost of care. But most importantly, we see that the experience and care gaps and the care experience for patients have improved by these innovations. So I'm personally very excited for all of the semifinalists and finalists in this category. And I'm excited for Kyle to share the results with us so we can rejoice and participate in the celebration.
Thank you, Archana. I'm Kyle Louie. I'm a partner at DCM. We've been investing in early stage technology investments around the world for the past 25 years and digital health investments for the past decade. About a decade ago, I was the founder of a startup that sold into employers, and I'm amazed at how much the employer wellness market has grown and evolved since then. This market is more important than ever in the world of remote work and COVID-19. I'm here tonight to announce the winner of the employer wellness category. The finalists are Amino, represented by Scott Keever, Chief Revenue Officer. Lark, represented by Julia Hu, co-founder and CEO. Grand Rounds, represented by Napur Shivastava, SVP of Product. And Collective Health, represented by Ali Daib, CEO. Congratulations to all the finalists. And the winner for the employer wellness category for 2020 is, drum roll, Grand Rounds. Congratulations. Accepting on behalf
Grand
of
Rounds provides a wealth of knowledge and resources. We are relentless advocates and an ever-present guide for members with medical and health-related needs. You can think of us as your member's personal healthcare assistant.
Hi, everyone. Thank you so much on behalf of Grand Rounds and to all the judges for this awesome recognition. All of the innovators in this category are doing really amazing work. And we know that they're all trying to help our members improve their healthcare outcomes for their employees. This year has been particularly challenging for all of us as we navigate the uncertainties of the pandemic. But here at Grand Rounds, we've been excited to rise up to the challenge and continue to scale and grow. Our mission is something that's been really important to us and has rung even more true this year. We want to raise the standard of healthcare for everyone, everywhere. We started with expert opinions, expanded into navigation, and now you'll see us get very excited to enter the world of virtual PCP and further our mission with these new products. This award is a great proof point. We are thankful to our team, and we are really excited to provide the care that we do for our 6 million members. Thank you, UCSF.
UCSF has one overarching goal, and that is to ensure the best possible healthcare is made available to everyone who needs it.
To do this, we bring our best scientific research out of the lab and into the hands of healthcare professionals.
We call this process translational technology development, and it underlies the commercialization of our medical discoveries.
The University of California has become a focus of life science innovation and collaboration.
Our San Francisco location means we're surrounded by some of the world's greatest healthcare pioneers.
Innovation Ventures exists to facilitate the development
and commercialization of new and valuable medical innovations.
Now, let's get the science off the bench and into the game.
As you might have guessed, just from the video you saw, we are now turning our attention to the University of California as we honor the digital health company with deep UCSF roots. And to present this, we welcome David Harkins, the Chief Investment Officer with UCSF Foundation Investment Company, and Dr. Anthony Francis, Executive Director, Office of Technology Management, UCSF Innovation Ventures.
Hi, I'm David Harkins. My team manages the UCSF endowment. And like other university endowments, we invest across asset classes in equities, in hedge funds, in private equity, in venture. And we also invest across the world. But what we're finding is some of the greatest innovation and best companies are right here in our backyard at UCSF. So we're really pleased to be involved with the Digital Health Hub and to see an award for our companies with UCSF DNA. What we hear over and over when UCSF is recruiting, that we're able to get the best scientists because they love the innovation and collaboration, and that often leads to company development and entrepreneurship. The way we tend to learn about the UCSF entrepreneurs is collaborating with Barry Selleck and his group with UCSF Innovation Ventures. And tonight's another one of those collaborations as I get to present here with Anthony Francis, who's joining us live from Australia. So Anthony, we'll turn it over to you to announce the winners.
Hi everyone, it's great to be here all the way from Australia. When Barry Selleck said work from home, I took that very literally. Seeing digital health grow at UCSF is one of the reasons I was hired and made the move to San Francisco to lead our Office of Technology Management. Digital health and its success is a real target of Innovation Ventures, and I'm very excited to be here and see UCSF awards and recognise the amazing people and companies who are helping for us all to gain better access to health data and knowledge. It's such a hard road, and those who take it deserve every accolade possible. On behalf of UCSF Innovation Ventures, I congratulate all the nominees tonight. The best company with UCSF DNA is Achille Interactive, represented by Adam Ghazali.
Well, I just want to say that it's my honor to accept this award on behalf of Achille Interactive. The last decade has been an exciting and challenging journey for our company, but our mission has been clear from the beginning, and we never really deviated from it, and that's what I'm most proud of. We really set out to create a new category of medicine to help people that are desperately in need of mental health solutions. I can proudly say that we've taken major steps towards advancing that mission. Achilles EndeavorRx has recently been cleared by the FDA as a prescription treatment for children with ADHD. This is a first on many levels. Notably, it's the first FDA-cleared digital treatment for ADHD, and it's also the first video game approved by the FDA as a treatment for any medical condition. Also, this was a medical device that was reviewed through the FDA's de novo pathway. And so its clearance really creates a new regulatory classification, really launching a new era of digital medicine. I'd like to give a shout out to my co-founders at Achille, Eddie Martucci, Matt Omernick, PureTech Health, and everyone at Achille who has been working so hard over the last 10 years. On a personal note, I'd like to give a thanks to UCSF and the many people supported this adventure from translating research from my laboratory into a new medicine for patients, and notably my team at Neuroscape for their incredible efforts in the fundamental research that's behind Achilles technology. Thank you.
Okay, congratulations to Achilles. And we are now at an important milestone. We're about halfway through our program. No kidding. No, this is our final award category. And for this, we're going to welcome Dr. Stefano Bini, professor of orthopedic surgery at UCSF and a founder of DocSF. And presenting with Dr. Bini, we bring back 2019 Hall of Fame recipient Sean Duffy, co-founder and CEO of Omada Health, to pass the Hall of Fame mantle next door to our next recipient.
Hi, it's Unity Stokes here with Startup Health, co-founder and president of Startup Health. It's a great honor to be presenting this evening the Hall of Fame Award. It's an extraordinary moment. As we all know, there's been extraordinary winners and nominees throughout the whole evening. And I get to announce 3 winners of the Hall of Fame Award. These are 3 extraordinary innovators, entrepreneurs, people who have been working really, really hard for so many years. So I'd like to kick off with the first winner, Hall of Fame winner, Doug Hirsch, the CEO of GoodRx. Can you please roll the video from Doug Hirsch?
Hello, UCSF. Thank you so much for this wonderful award. Trevor and I have spent over a decade trying to help Americans get the care they need at a price they can afford, and we're so thrilled to be recognized by UCSF. In all honesty, we think you guys are the true healthcare heroes, the doctors, the frontline medical workers, the pharmacists. You guys are doing all the hard work. We're just trying to give Americans the tools they need so that Americans can be more educated and make smart decisions to get the healthcare that they truly need. So thank you so much. We really, really appreciate it. Keep up the good work, and we're here to help. Thank you.
And obviously, it's been an extraordinary day for Doug and GoodRx. Congratulations to them, very well deserved. So the second Hall of Fame winner tonight is Amwell, President and CEO of Amwell, Roy Schoenberg. Play the video, please.
This is Roy Schoenberg, co-CEO of American Well. First of all, I'd like to thank everybody for the nomination for the award. It's a privilege to get the award from Glenn and Sean. We are particularly humbled to see how those technologies have served the purpose to allow people to get the healthcare that they need at a time where alternatives were slowly diminishing. This award is not for myself and Ido. It is an award that I think should be shared by every member of the family of American Well. That includes everybody that has worked tirelessly over the last 15 years to give us the opportunity to serve the purpose of allowing us as people to expect better health care to come to us in years to come. We are humbled, we're thankful. Thank you all of us for being here today, and we hope to serve everybody for a better future in years to come.
Congratulations, Roy and the Amwell team. Extraordinary work. And the third and final Hall of Fame winner this evening.
Thank you to UCSF and the Digital Health Hub for this remarkable recognition. When I look at the list of previous recipients, I'm honored to be anywhere near this category. But we all know that personal awards or individual awards are really the product of the incredible work of teams. And the team at Accolade, 1,300 strong, has been hard at work over the last year in a world that needed healthcare more than ever, in a world where healthcare disruption was so significant, a world where our 1.7 million members needed our help more than ever. Our people stepped up and stepped into the breach created by the incredible disruption of the pandemic in 2020. We're proud of the work we've done. We're certainly very proud of this honor that I'll accept on behalf of my entire team, and we're thankful to be included in this event.
And Sean Duffy's here. Sean, you were the winner last year. I'd like to pass the baton quickly to you before passing off to Stefano to share a few words. You know, it's an exciting moment in the whole ecosystem. You won last year. Sean, we'd love to hear from you.
Yeah, happy to. Firstly, just enormous congratulations to the winners of this year's UCSF Digital Health Hall of Fame Awards. So, incredible companies, incredible people, and incredible teams. When we won the award last year, digital health was important. I think there was a recognition that it was a mission critical part of transforming the US and global healthcare system into something that was better for patients, better for economies, and improved outcomes, from afar. In the context of today's pandemic, digital health is more important than ever. And I think it's our obligation, the community's obligation, to take this moment in time to recognize that, if anything, we all need to double down our efforts, double down our vision, and think even bigger than we ever have before on what digital health needs to do for society. And I look at the companies that received the award. Every single one of them meets the criteria of incredible people, mission orientation, with incredible progress against really, really big problems. So huge congrats. Honored to, in essence, pass the torch along to wonderful people and join a great cast of characters as a Hall of Fame award winner.
Sean, thank you so much. And you have been such an inspiration. I think all of these leaders are such an inspiration. I know we all are pushing for a lot more diversity next year in these winners and more women leaders. There's so many extraordinary health transformers who have won tonight. So we're really, really inspired by all the nominees, all the winners throughout the evening. So just want to send everyone a congratulations, a thanks to UCSF and the Digital Health Hub. And now I want to pass it off to one of my favorite people, Dr. Stefano Bini. He is the professor of clinical orthopedics and the chief technology officer in the Department of Orthopedic Surgery at UCSF. You are such an important person in the ecosystem, helping so many innovators. Close us out, Dr. Bini.
Unity, thank you so much. So delighted to receive the baton from you and to hear from Sean. Congratulations again from last year. Look, 10 years ago, Mark could have held the Digital Health Awards ceremony in a small hotel room by the airport, and he would have had seats left over, right? Now, 5 years ago, clinicians engaged in digital health were asked what it was and why it mattered. And fortunately, our very own Bob Wachter wrote the book, The Digital Doctor, on that very topic to solve that question. But today, no one is asking what digital health is, right? They're asking how quickly can we build it? And not only that, they're providing a decent chunk of change to build it with. No excuses on that front if you follow this month's IPOs, right? Now, for us physicians, this is a uniquely exquisite time to be involved. We get to partner with the brightest minds in technology to solve problems that have vexed us for generations. And we get to use technologies that were pure science fiction when we were students. And the medical students of today, for them, it's a very exciting time. They will not need to innovate by standing on the shoulders of the giants that went before them. That just takes too long. They're going to take the express elevators that were designed by the companies we heard from tonight and go straight to the top of the edifice. And it's from that vantage point that they get to redesign the entire care paradigm. So this is a very exciting time. It was a very exciting evening to match the exciting times. I want to congratulate Mark and all the team that put it together, and congratulate the winners of the UCSF Digital Health Awards 2020. Back to you, Tui.
All right. Well, thank you so much. As you can see, tonight is all about UCSF and our incredible digital health warriors. Congratulations to all the nominees and all the award recipients. I know that Mark Goldstein and Barry Selleck have a few closing remarks they would like to make, and I'm going to hand off the mic here to you.
Thank you, Tui. This has been an amazing experience for us all.
Technology is incredibly wonderful, as we've seen a few glitches, but I think I am so proud of our team, and I'm so proud of what everyone else has been able to pull off today. Andrella Das is basically, she ran the back of you don't even know what was going on behind all this. There were 10 people pinning things, and we're done. We are done, and we are glad to be done. And next year, we're going to learn a lot, and we're all going to be together, and I can't wait. And Barry, I know you have a few comments.
I do, Mark. Thank you very much. And I would like to start out by acknowledging Twee, who, had you not already won 7 Emmys and your Edward R. Murrow Award, I would say you're eligible for your second Edward R. Murrow Award, which is named in honor of the famous war correspondent, Edward R. Murrow.
I felt like a little bit of a war and a lot of battles going on.
Yeah, you did a remarkable job, and we all greatly appreciate it. With respect to the finalists and the winners, I just want to congratulate everyone. As a former CEO myself, I know it's every entrepreneur's dream to not only build a successful company, but to actually launch a product that's in the marketplace, that's benefiting patients and care providers. That's everyone's dream. So I just want to congratulate every single one of you for having gotten this far through this HealthHub UCSF Digital Health Award process. And finally, this would never have happened without the vision and leadership of Mark Goldstein. As we've said throughout, Mark was the original visionary behind HealthHub. He had a vision at least 3, if not 4 years ago, for the promise and the value that digital health technology was going to play in the upcoming healthcare environment. And so, Mark, I just want to thank you and congratulate you on having put together a truly remarkable program.
Thanks, Barry. In closing that, what you're going to see is this has been an event where we've not only had 150 people participating, and you've seen them pinned on and off and the like, but you're going to see a list of credits and people behind the scenes. There's a lot of work in these Zoom events. A lot more work than it was online, and we couldn't have done it without our amazing team. We have an amazing team of folks here. Thank you all, and good night. And it's all going to be nicely and tightly recorded. And thanks, John. Thanks, everyone.
Bye-bye.
Good night, everyone. Thanks.
Stay safe, wear your mask, keep your distance.